Hi, this is Susan Samson. I am at Mayo Clinic in Jacksonville, Florida, and I'm here to speak to you today about some results we presented at the most recent Endocrine Society meeting in 2022. I'm going to talk about the optimal trial and also how the data from the extension have given us a view to the long-term efficacy of this medication. So the optimal trial was interesting because it had patients in it that had acromegaly, but they're being treated with injection somatostatin receptor ligands. So monthly injections or other intervals to control their growth hormone levels and subsequently their IGF-1 levels. And if these patients were controlled and they were eligible for the trial, they entered into a double-blinded placebo-controlled phase. So one group of patients received oral octreotide capsules. So now this is a pill rather than an injection, given at 20 milligram capsules twice per day to be titrated up to 80 milligrams total. The other half of the patients received placebo. So those patients went through a double-blind placebo-controlled phase that was 36 weeks long. And what we were looking for in the data is, were those patients controlled on the oral octreotide, remembering that they were well controlled on the injection somatostatin receptor ligands? And if they were not controlled, they had the ability to go back to their previous injection. Because of course we needed to rescue these patients if they had symptoms and their IGF-1 started to rise, especially on placebo. So at the end of that 36 weeks, if the IGF-1 was equal or less than the upper limit of normal for their age and sex, they were considered responders. Now, the newest data we presented this year was looking at how those patients did the longer they were on octreotide. So after the 36-week phase, they were eligible to enter what we call an open label extension. So it's not blinded anymore. All of the patients are getting oral octreotide. And that means some patients were already on oral octreotide, and some patients actually were on placebo. So there's a proportion of patients who actually were not even on the oral octreotide until they entered the extension. So at this point, you have two groups, one on placebo and one on oral octreotide, who now enter and all start on the drug. So what the open label extension was really looking at was, how do those patients do? Does the IGF-1 stay controlled? So if they came in controlled, how do they do on this drug? If they came in and they weren't controlled, how do they do on this drug? And last year we analyzed the first 48 weeks and really found that in the patients who came in already on oral octreotide, that their IGF-1, mean IGF-1 for that group, stayed under the upper limit of normal for IGF-1 for that particular 48 weeks. For those who came in on placebo, their mean IGF-1 was above normal, and now being put on oral octreotide, the mean IGF-1 came into the normal range. So that was very exciting. So this next data that we have analyzed from the open label extension has looked at, how did these patients do from week 48 to 96? In other words, they've been in this open label extension now for 2 years. And what's really exciting about that is we see that if they were a responder at the end of the first year of the open label extension, 100% of those patients maintained their IGF-1 in the normal range from 48 weeks to 96 weeks. So that's how durable the effect of this drug is, which is one of the most important things I think patients want to know. If it's working for me at the beginning, how long will it continue working for me? And I think this data is really exciting in thinking about the fact that 96 weeks out in the extension, that these IGF-1 levels were still controlled for these patients.